Alright, so as you can see, the Astral is a touchscreen module. We have 4 main menus over here. Each main menu has sub-menus over this side. The Astral has a lock mechanism for screen and also for clinical. This is a screen lock. So in order to unlock, we just press the hand icon and then press the button to unlock. As for the clinical lock, we need to press the lock button over here, continuously press and hold until you enter clinical mode menu. We advise to select unlimited, because unlimited will give you more time to make changes, and once you are done, you can lock it manually. The first icon, which is the lung picture, is the monitoring from the patient. The sub-menus will have waveform, pressure and flow, monitoring of the patient, which is inclusive of pressure, peak inspiratory pressure, PEEP, tidal volume, and the FiO2, which is the patient receiving. This Astral is a turbine portable ventilator that can ventilate patients on 21% of room air, and you can add on supplemental oxygen from the regulator. The second main menu is a setup for the ventilator. You have about 6 sub-menus, which is mainly programs to have 4 different programs. So you can have one program for each doctor or each different patient. We have setup assistant, which is a calibration step, and it's quite easy to understand the calibration step. I will show you how does it look like. So once I have selected the setup assistant, if I want to calibrate, I will press start. It will ask me whether you want to continue and some prompt notices. I will choose which patients which I am going to use the ventilator on. For this instance, adult, and what type of adapter that I will be using for the patient. So if I have attached this adapter, this is for double limb tubing. If I have attached this adapter, it will be a single limb tubing, and this is for single limb with leak valve. So as you can see, this device has been attached with a double limb adapter. So we select the double limb icon, we start the learn circuit. So it will show step-by-step pictorial and some description on top. The first one, it asks you do not connect any filter or tubings, and we press continue for the first step. It will blow some air. Second step, it will ask you to fit any antibacterial filters on the inlet and the tubing that you are about to use, while making sure the end of the tubing is not attached to anything. This process is for the machine to learn the resistance it is going to be used on and the length of the tubing. Once we have attached the tubing, then I press continue. In this process, it will blow some air to measure the tubing length and filter. The final step will be blocking the cap, blocking the end of the tubing with a cap, and also to press continue. when the learn circuit is successful, all the parameters will be clicked green. So learn circuit successful, green, okay. Device is functioning well, okay. The oxygen cell is functioning well. The built-in flow sensor is functioning well. After this, we select the patient's interface. The Astral, as you can see, can be used on endotracheal tube or ETT patient or tracheostomy patient, NIV, non-vented mask for double limb tubings. So I will select invasive, and it will give me some prompt description to adjust according to my interface. The next thing, it would allow me to select the ventilation mode. So we have a volume and pressure mode. We have a volume control, pressure control, volume SIMV, pressure SIMV, PS or BiPAP, and fixed pressure or CPAP. So I will select now is volume. So as you can see, once I selected the ventilation mode, next thing I go to the settings, which is here, and the settings, in order to change, is by selecting any box and pressing the up arrow to increase or the bottom arrow to decrease. So once I've made my changes, I have to select apply. If I don't select apply, it will go back to the original self. So I'll do some parameter changes. Okay, maybe I put PEEP up to 6, my respiratory rate maybe 18, my volume perhaps 600, and press apply. And then we focus on the third main menu, which is the alarm. The alarm is very straightforward to set. Upper limit alarm, lower limit alarm, upper limit, lower limit. To make changes, the same thing, we select the box, we use the down arrow to decrease, we use the up arrow to increase. Once we are happy with what alarm we have, we press apply. So we have 3 different alarms. We have one alarm for tidal volume, minute ventilation, pressure, upper and lower limit. We have alarm of respiratory rate on the second page, upper and lower, and alarm to trigger if ventilation suddenly stopped. Third alarm will be the FiO2. If you want a capping to have an upper limit and lower limit.